ಹಾಯ್ ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ನಾನು ನಿಮ್ಮ ಸಂದೀಪ್. ವೆಲ್ಕಮ್ ಟು ಸ್ಯಾನ್ಶೈನ್ ನರ್ಸಿಂಗ್ ಸ್ಕಿಲ್ ಸ್ಟುಡಿಯೋಸ್. Today I am here to talk about physical examination. Yes, physical examination plays a very important part in the nursing profession. Today we are going to see the actual definition of physical examination, what are the principles of physical examination, what are the methods of physical examination, and so on. Also, we are going to learn the equipments or the articles essential for conducting this physical examination, how we are going to carry out these procedures step by step. ಇವತ್ತು ನಾವು ಫಿಸಿಕಲ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ತಿಳ್ಕೊಳ್ಳೋಣ. ಈ ಫಿಸಿಕಲ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಅಂದರೆ ಏನು, ಅದನ್ನು ನಾವು ಯಾಕೆ ಕಲಿಬೇಕು, ಅದರಿಂದ ನಮಗೆ ಏನು ಉಪಯೋಗ, ಅದ್ರ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ತಿಳ್ಕೊಳ್ಳೋಣ. ಅದ್ರ ಜೊತೆಗೆ ಈ ಫಿಸಿಕಲ್ ಎಕ್ಸಾಮಿನೇಷನ್ನ ಡೆಫಿನೇಷನ್ ಅಂದರೆ ಏನು, ಅದರದ್ದು ಪರ್ಪಸ್ ಏನು, ಅದರದ್ದು ಪ್ರಿನ್ಸಿಪಲ್ ಏನು, ಅದು ಫಿಸಿಕಲ್ ಎಕ್ಸಾಮಿನೇಷನಲ್ಲಿ ಒಂದು ಸ್ವಲ್ಪ ಮೆಥಡ್ಸ್ ಇದ್ದಾವೆ. ಆ ಮೆಥಡ್ಸ್ನ ನಾವು ಯಾವ ಥರ ಕಲಿಬೇಕು, ಯಾವ ಥರ ಅಪ್ಲೈ ಮಾಡಬೇಕು ನರ್ಸಿಂಗ್ ಪ್ರೊಫೆಷನಲಲ್ಲಿ, ನಾವು ಫಿಸಿಕಲ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಮಾಡಬೇಕಂದ್ರೆ ಅದಕ್ಕೆ ಯಾವ ರೀತಿ ಆರ್ಟಿಕಲ್ಸ್ನ ನಾವು ಅರೇಂಜ್ ಮಾಡಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ತಿಳ್ಕೊಳ್ಳೋಣ ಬನ್ನಿ. ಫಿಸಿಕಲ್ ಎಕ್ಸಾಮಿನೇಷನ್, it plays a very vital role in the life of every nurses, because using which a nurse will do a complete assessment, a thorough assessment of a patient's health condition. Because when the patient comes to a nurse, she will be the first person to know each and every details of a patient. Let's find out what are those. But before going on in detail, let us know what are objective data and subjective data. So objective data, it is the information that professionals gather through observation. Subjective data, it is the information that comes from the patient or patient relatives or friends, their opinions and perceptions. Physical examination can be done by a nurse in outpatient department, inpatient department, or in the community setup as well. A complete physical examination includes a thorough examination of a patient starting from his head to toe, including vital signs. To begin with, let us understand the meaning and the definition of physical examination. A meaning states a medical examination to determine a person's bodily fitness. A definition states it is a process of examining the body by means of observation, palpation, percussion and auscultation. The other definition says it is a systemic collection of objective information that is directly observed or is elicited through the examination techniques. Actually, why should we do this physical examination? Why should we apply all the principles to do this physical examination? Here are the few purposes which says why actually we should do the physical examination. One, to understand the physical and mental well-being of the client, which is very important. And the second one is to detect the disease in its early stage and to determine the cause and the extent of the disease, to understand any changes in the condition of the disease, to determine the nature of the treatment or nursing care needed for the client, to safeguard the client and his family by noting the early signs, to contribute to the medical research, also to notify if a person is medically fit or not. So, how to conduct this physical examination? It is very simple. We need to apply these techniques while conducting the physical examination procedure. The first technique is inspection, second is palpation, third is percussion, fourth is auscultation, and fifthly manipulation. So come, let's understand every techniques of physical examination in detail. So to begin with, we will start with the inspection. The inspection is nothing but it is a visualization of the patient's body through the naked eyes, which we can do the examination of every body system, overall appearance of health and illness, signs of distress, facial expression and mood, body size, grooming and personal hygiene. get best results under inspection method, we just need to follow some principles such as good lighting, either daylight or artificial light, exposing the body parts being observed only, look before touching, warm room for examination of the client, it should not be too cold or too hot, observe for color, size, location, texture, symmetry, odors and sound. Compare each area inspected with the opposite side of the body if possible. Use pen light to inspect body cavities. The pictures which is being displayed in front of you right now are some of the examples that we can find during the time of inspection in some patients. Some of the commonest observation that we can do during the time of inspection in some patients on the skin, such as erythema, cyanosis, jaundice, pallor, vitiligo and skin lesions, are commonly found in some patients. The other technique used in physical examination after inspection is palpation. In a simple word to explain palpation, it is nothing but touching and feeling the body parts of a patient and finding out the problems. One of the best example for palpation is feeling the pulse rate of a patient. Also assessing the texture, shape, fluid, size, consistency of a body organ. So there are also some other examples where I can tell you for the palpation method is checking the body temperature of the patient, whether the patient's body is too hot or too cold, and also checking for the thyroid, that is palpating the thyroid of the patient. Also we can even check the skin texture and moisture and turgor of the patient. Also we can able to check the fatigue edema, where to rule out if the patient is having any kind of fatigue edema that is related to the cardiac disease condition or any blockages in the leg veins. It can also help us to rule out any kind of liver diseases, or also it may indicate any pregnancy. Now let's move on to another technique under physical examination. It is percussion. It is tapping the person's skin with short, sharp strokes that yield a palpable vibration and a characteristic sounds that interpret the location, size and density of the underlying organs. Now to understand about the procedure, how to do the procedure, as it is already said, it is a tapping the person's skin with short sharp stroke. How to do the tapping? The tapping method is very simple. We have to use our non-dominant hand on the patient's skin, and by using your dominant hand we need to just tap on the middle finger of the non-dominant hand to get the sound that is called resonance. The percussion produces the characteristic tones of tympanic, hyperresonant, resonant, dull and flat. So these are the sum of the sound that we will be getting while using this percussion method, that is hyperresonant, resonant, dull and flat. Now let's move on to another technique under physical examination called auscultation. Auscultation is nothing but hearing the sounds. So auscultation is a method used to listen to the sounds of the body during a physical examination. It means to listen to the sounds that are found within the body, like maybe the heart sound, the sound in the respiration, that is lungs, stomach or a bowel movements, etc. Usually it is done by using a stethoscope. It is usually to amplify the body sounds. So now to know about another technique under physical examination. The another technique which we are going to discuss right now is called manipulation. What is this manipulation? It is a systemic moving of patient's body part. We also call it as a range of motion to check for any abnormalities and to determine the range of motion of joints. It is done passively assessing the range of motion of a joint, and it is done by the physician or the physiotherapist to know if there is any sort of abnormalities found in the patient, and if it is found they will be able to understand how exactly it is and what degree of abnormalities These were some of the techniques that we use under physical examination. Now, by using these techniques, how to do a head-to-toe examination. Before that, let us know the role of nurse in general examination. The role of nurse plays a vital role in preparing the environment, that is maintaining of privacy, lighting, comfortable bed and examination while conducting this procedure, because privacy is very important for the patient in conducting the physical examinations. A separate room is needed and a door should be shut and relatives are not allowed. The lighting, it should be adequate light so that we can able to see properly, and comfortable bed which is provided for the client. So now, to know about the preparation of the examination, as already mentioned, a privacy, that is a warm, well lighted, quiet room must be provided for the patient, and we have to wash our hands, we have to introduce ourselves to the patient, and we have to seek the permission for the examination and to be polite to the patient, and stop me at any time if it becomes uncomfortable or I cause you any discomfort. This is what we have to instruct to the patient. So now, to begin with the physical examination, that is head to foot examination, we need to arrange some articles at the bedside of the patient. What are those articles? Like stethoscope, BP apparatus, fetoscope, TPR tray, tongue depressor, pharyngeal retractor, laryngoscope, tape measure, flashlight, weighing machine, ophthalmoscope, otoscope, tuning fork, etc. So let us have a look into these articles and make a note of it, because it is very important to arrange the article. The other articles required are nasal speculum, percussion hammer, vaginal speculum, proctoscope, gloves, sterile specimen bottles, notepad to make a note of any kind of abnormalities that is being observed during the kind of physical examination. I am going to display few of the images of these articles which will be very helpful for you to know and to identify the articles. So, to begin with general examination, it is carried out in an orderly manner, focusing upon one area of the body at a time. It includes general appearance. General appearance of a person, which includes nourishment of a person, body build of a person, health of a person, activity of a person. Along with general appearance, we also concentrate on mental status, which include consciousness, unconscious, talking, anxious, worried, depressed, etc. So here are the some of the images which tells you about the general appearance. So general appearance, it might be fat, thin, moderate, and also it will be coming under well nourished, malnourished, or moderately nourished. So these are the few categories which we can consider the patient under the categories of general appearance. So now let's talk about the postures. The body postures, it includes the body curves which also has any defects like lordosis, kyphosis, scoliosis, any movements, abnormal movements, any limping is found in the patient, height and weight, skin conditions like color, like maybe the pallor, jaundice, cyanosis, etc., texture like dryness, wrinkling, excessive moisture, temperature like warm, cold or calming, and lesions like maculos, papulos, etc. are seen in the patient should be noted immediately. The relevant example for these as follows. So now let's move on to the physical examination of head and face. In head and face, we are going to identify for the shape of the skull or the fontanelles in the newborns, the skull circumference, scalp, cleanliness, conditions of the hair, dandruff, pediculi or infection. In the face, we have to find out if there is any kind of puffiness, fatigue, pain, fear, anxiety, enlargement of parotid glands, etc. So the relevant example for this are as follows. Now let's move on to the another part of physical examination in the body. It is very important because it is very sensitive organ in our body. Yes, I am talking about eyes. In the eyes, we are going to observe for the eyebrows whether it is normal or absent, eyelashes, eyelids, eyeballs, conjunctiva, sclera, cornea, our iris, pupils and the lens. So in the eyebrows, as I already mentioned, we have to check for the normal or absent, eyelashes for infection, eyelids for any kind of edema, eyeballs for sunken, conjunctiva for any red or pale, sclera for jaundice, cornea for irregularities, pupils for dilated or constricted, and lens for opaque or transparent. So these are the examples which is related to the eye under physical examination. Fundus of an eyes also plays a very important role where we need to identify for any congestion, hemorrhage or spot. Eye muscle for any kind of squint, vision for normal vision or a short vision or a long sight. When we talk about the ears, we need to inspect for the external ears and for the internal ears using the otoscope. External ear can be visualized through the naked eyes for any kind of discharge, cerumen, obstruction of the ear passage, tympanic membrane, perforations, lesions or bulging. Hearing can be done by using the tuning fork test. We can do the test of hearing by using a tuning fork test. So now let's move on to the other part of the body, that is nose. In the nose we are going to visualize for the external nares, that is for the crest or discharges, and for the nostrils for any kind of inflammation of the mucous membrane, septal deviations. And in the mouth and the pharynx we are going to visualize for the lips, that is for any kind of redness, swelling, cyanosis or stomatitis, and for the odor of a mouth, that is for the foul smelling, teeth for any kind of discoloration and dental caries, mucous membrane for any kind of ulceration and bleeding or swelling, tongue for any kind of pale, dry, lesions, etc., throat and pharynx for any kind of enlargement. And now coming for the neck. So what are the things that we are going to visualize in the neck? So firstly, in the neck we are going to identify for any kind of lymph node enlargement which is palpable, thyroid gland enlargement, range of motion, that is flexion, extension and rotation of the neck, and in the chest for the thorax, that is for the shape, symmetry of expansion and posture, and breathing sounds, that is any kind of wheezing, cryptation, pleural rub, etc. Heart for the size and location, cardiac murmur, and breast for any kind of enlarged lymph nodes. Now, for the physical examination of the abdomen, there are few things that we will be able to observe. That is for the skin rashes, distension of an abdomen, hernia, pregnancy, etc. Also for the auscultation, we are going to able to find for any kind of abnormal bowel sounds, fetal heart sounds, palpation of the liver and spleen, tenderness at the abdomen. Percussion include presence of gas, fluid and masses, and extremities which includes the movement of joints, tremors, clubbing of fingers and varicose vein, reflexes, etc. So these are the few things that we are going to find in the abdomen. And now, coming for the physical examination of a back, we are going to observe for any kind of spina bifida curves, and in the genitals and the rectum, inguinal lymph glands enlarged and palpable, patency of urine, meatus and the rectum, descent of the testes, vaginal discharge, and presence of any kind of sexually transmitted diseases or any kinds of hemorrhoids or enlargement of prostate gland is what we are going to find under the genitals and the rectum. So here are the some pictures which will be helpful for you to identify these causes. So guys, this is all about physical examination. Very soon I'll meet you with another topic. Till then, take care. Bye.